Hey guys, and welcome to another video about borderline personality disorder. Now, in the past couple of days, I've been getting a bit busy on Reddit. This is the first time that I'm actively posting and replying on comments on Reddit, and I have read a number of posts regarding the condition, and I could relate. I was able to relate to a lot of them, and I was able to analyze a lot of the situations I've read and a lot of the things that people wrote. I was able to analyze and reflect back on the condition and relate to the biological root of the condition. So it's like a puzzle. It's like seeing a puzzle and you have different puzzle pieces and you have to match those puzzle pieces with the correct place where you put the puzzle piece. So for example, you have the clinical manifestation of having a high devaluation of the person you're with, so that goes onto the puzzle place or the puzzle piece of having an amygdala hyperstimulation, so knowing that kind of mechanism and how that reflects on your actions directly allows you to monitor the situation in a much more effective way. So it gives you the kind of bird's eye view. So if you're an eagle, if you're a bird and you're flying around, you're able to see things from a much wider perspective, and then you can see, okay, this happened here, right? This is caused by that which is here, and this leads to that. So you're able to analyze this all from this perspective, and this gives you the power of insight. So you're able to read and understand your behavior and why it's caused, and this ultimately allows you to alter and adjust your behavior based on what is supposed to be normal and what is not supposed to be normal, right? So that's the benefit of having this kind of eagle eye to the situation, the monitor, and to see everything from a broader perspective. And the replies that I've been getting on Reddit were quite positive. I was surprised because I didn't know what to expect. I didn't know if people were happy or if they were not happy about the responses, but I was surprised that the responses were good. People were saying that they have not seen these situations from that perspective and they really enjoyed it. So this motivated me to go on and to continue with the videos and make another video. And today I want to go in further detail into the biologic root of the condition. And this might be a topic that some people find repelling. So the biologic, start off with writing this down, the biologic basis. Physiological pathways in the brain related to borderline. And I do realize that some people might find this boring, or they might find this irrelevant to tackling the topic, because how does this relate to solving the situation? What does this have to do with finding a solution or a practical way of how to deal with it? Well, it has a huge emphasis because, first of all, let's ask ourselves why. So there are two main reasons why we want to do this, or why we want to know this. It's not just because we're curious. It's not just because we want to show off by the fact that we know a lot of information. It has two purposes. The first purpose is allowing us to gain insight. The bird's eye view. Just like the example that I explained at the start of this video. Now the second reason is knowing what kind of medication. Knowing what medication, or let me capitalize this, what medication to use, when, and why. And this is a common problem in psychiatric conditions, that this part is not really explained. This is not really explained to patients, and patients don't understand what they're taking. They don't understand when they should take it, and they don't understand why they should take it. So this causes a sort of big dilemma for a lot of patients that could result in them not taking the medication because they don't understand why they feel the way they feel when they take the medication and what kind of difference it actually exerts. So it starts off with this order. You start from here. Once you have the insight, and once you know when a certain biological or pathophysiological pathway is hitting in, you gain the insight, and then you understand, okay, this is hitting in right now, and that allows you to understand what, when, and why you use a certain medication at what given time. So that's the order. Okay, so this should be number 1, this should be number 2, and this should be number 3. So it goes like that, right? So that's how you understand what's actually going on. Now, what kind of pathways do we have? We have 3 or 2 main pathways. No, actually 3 main pathways that are believed to be responsible for borderline. Now, the first pathway, and this is based on a lot of research papers that have been done, but conclusive evidence has not been established yet. And the reason for that is because it's hard to find animal models who have borderline. It's hard to identify it in animal models, so it's not a disease that is present in animals, and hence it is very hard to analyze on a biologic scale. It's hard to take samples from patients because patients are alive. It's unethical. So and because you don't have animal models, it's hard to dissect animals and to take direct biological samples. So what you have to take are samples that are not so direct as anatomical samples. So for example, we take cerebrospinal fluid and we analyze the amounts of dopamine in that fluid, and then we can say a suggestion. So these are suggestions that are based on valid information. So even though the evidence is not conclusive, it is quite suggestive, and it has a high likelihood of being true. And what makes it even true is that if you use certain medications that tackle this pathway, the likelihood of effect is high. So the first pathway that I want to mention is the amygdala hyperstimulation, and that is so important. Now, the amygdala is a primitive organ in the brain. It's not really an organ. It is a part of the brain that is primitive and that has stayed with us in the human brain since early phases of evolution. And it has a very basic task, which is emotion regulation. So it is the part in the brain that processes stimuli, outside stimuli, that you observe with your senses. And it gets processed in the amygdala. And then the output is emotion. So it's either fear, rage, happiness. And these basic emotions dictate the ways you behave as a human, and this is very important for your survival as a species. So it's a very primitive organ with very primitive tasks, emotion regulation. And the problem is that we humans as a species are superior to other animals because we're able to regulate emotions, we're able to analyze an emotion, and we can choose not to act on an emotion. So that is a very advanced capability. This does not really happen so effectively in borderline because emotional regulation is disrupted. Why? Because the output of the amygdala is so high. There is a hyperstimulation of the amygdala, and this causes it to be constantly having a higher activity. Why is that the case? Well, it's believed that early childhood stress, or not early childhood, but elevated levels of stress during neurodevelopment can cause this, and I've explained this in the previous video that I've done about this. The first video that I've done, I've explained what is meant by stress levels and how they affect the amygdala. I'll just go through it in a fast, brief, summarized way. Is that if the child or the person who is growing up is still in a phase in which the brain development has not fully matured, the brain parts that are undergoing development are more sensitive to various chemicals and various hormones, and can be changed based on the levels of these hormones. So if the stress hormone levels are high, like cortisol, what happens is that this causes an abrasion or damage on the amygdala. So this damages the amygdala, and the result is that the amygdala loses size and loses function as a histological tissue. Now the brain is able to realize that this is happening, and as a result it causes a physiologic adaptation mechanism, which is to hyperstimulate the amygdala's function to preserve whatever function is remaining and whatever function is left. So this causes any kind of emotional response that you go through as borderline to be coming out as an exaggerated response. Right? Now, how is this important in understanding how to have the bird eyes view that I talked about at the beginning? Now, that's important because realizing that all your emotions are exaggerated allows you to say, is this emotion is over. It's hyper. It's hyperstimulated. That means that I don't want to act immediately on the emotion. I want to give it time to wear down. Now, the time to wear down, now this kind of thought process is based on knowing this kind of information. So if you know this kind of information, it allows you to be convinced of this thought process. So you're not going to take immediate action. You're going to say, hey, I'm going to slow down because I know that my emotion is over. It's hyper. And I'm not going to act on hyper emotion because that's not real. I'm going to wait for it to wear down and calm down. It takes time. And then I'm going to take a action that is based on rationale and not based on a hyper-stimulated emotion. Okay, so this gives us the bird's eye view on the topic, and this is applied on different situations. So we have this when, for example, we're talking about if you're going through a phase of devaluation towards your partner, if you're going through a phase of extreme sadness, fear of abandonment, and most importantly, or the worst, rage and splitting, if you have the splitting, because this is that symptom that is so debilitating towards people around you and yourself, the splitting and the kind of fighting sensation that you have towards your partners and friends. It's terrible because you lose what is so important to your life. Now, partnerships and relationships in life are so important, and you lose them because you rage and you split and you don't see anything good anymore in your friend or in your partner because the emotion is hyperstimulated. Now, if you have this kind of insight about the biological pathway, you're not going to act on this rage. You're going to say, okay, this rage is out of place. It's not real. I know it's not real because of this here. So I'm not going to act on it. I'm not going to act on this rage. And I've seen a response on Reddit. Some guy said that he gets really enraged by his girlfriend when she cries and he doesn't really understand why. So I told him, okay, first of all, you get enraged by the girlfriend if she cries because that gives you the impression that you're at fault, and it has a certain manipulative aspect to it. So she cries because she wants to make you look bad, and that causes you to rage. Now, he did something great. He said whenever he started to rage, he never really acted on it. He always said, okay, I'm going to go away, and I'm going to leave her for a moment until this rage wears off. And I told him that's exactly what you have to do. And being able of disengaging and not acting on this emotion can be reinforced by knowing the biological pathway, because now you're not getting tricked anymore. Now you know that this is happening. Okay. How does this help us in treatment and management? This helps us in knowing the management or the pharmacological intervention, because now we know that we want something that inhibits the amygdala hyperstimulation. We don't want it to be hyperstimulated. We want to inhibit the function of the amygdala. And for that, unfortunately, there is not any pharmacological agent that is effectively able of doing that. But this is a basis for research. So if you're watching the video and you happen to be working in the field of drug discovery or drug design, this is a pathway that can be potentially commercialized if you can be able to design or rationally alter a drug. And one of the molecules that really have an effect on this is oxytocin. And you might try to elicit this on a natural response, if you have oxytocin, this is usually released in males or in females after orgasm, and the purpose of this hormone is that it causes bonding between two individuals, and oxytocin has a suppressing effect on the amygdala. So the emotion of rage or the hyperstimulation of the amygdala is inhibited through oxytocin, although it's not really that effective. So there have been some studies about using oxytocin nasal spray in the doses of 40 international units, and they have been using this kind of application for patients with borderline, and they noticed that yes, it helped in lowering down symptoms of aggression and rage, but it was not so effective. And I think from a purely medical or scientific perspective, it's because it's true, a nasal application of oxytocin has a more direct mechanism of action on the brain rather than the rest of the body, because oxytocin acts on the whole body, not just the brain. But it's not so specific for the brain, that it means it gets absorbed in different parts of the body before it actually reaches the main place of action, which is here, and the effect of action is not going to be so strong. And that's why this has to be worked on. This has to be rationally, we use this term, rational drug design, to alter oxytocin to make it more specific to work on the amygdala to cause inhibition. So, unfortunately, we're not yet able to do this. You can try, however, to take oxytocin as a nasal spray because it is a nutritional supplement. It's not considered a drug yet, which is quite odd. But you can obtain it from Amazon because it's considered a nutritional supplement and not a prescription drug, and it doesn't really have any kind of obvious side effects. So you can try it out, you can try to play with it, but I would not depend on it. I've tried it out myself. It did not really work on splitting and rage at all. I don't know if this has something to do with the fact that I'm a male. Maybe it works better on females. Still lots of question marks on here. There is something else, however, that I'm going to mention in the video that can really help the rage very effectively, and this is the next part that I'm going to talk about, which is NMDA receptors or action. Receptor action. So there's a receptor in various brain tissues and regions in the brain that uses NMDA receptors, and for this we use, or a molecule is used which is called glutamate. So glutamate acts on this receptor, and it causes this receptor to be hyperstimulated, and this receptor is also partly responsible for certain emotions that you feel, including rage. So it has little to do with sadness or happiness or excitement. It has more to do with rage in specific. And using a pharmacological agent that can inhibit the action of this receptor will cause the inhibition of rage. And fortunately there is a pharmacological agent that causes this, which is Memantine. So Memantine is a drug that it's a prescription drug. It's usually used in Alzheimer's because it's supposed to inhibit the action of this receptor, and hence it improves memory, because apparently there's a pathway involving this receptor in Alzheimer's. Now this here inhibits the action of this receptor and improves Alzheimer's. Now there has been a study that was published in 2018, so it's a really recent study that has been started, I think, in 2014 and has been concluded in 2018. It's quite a fairly successful study. It was a study that evaluated the safety and efficacy of Memantine in borderline specifically, and it turns out that yes, it helped. It helped a lot. It helped a lot in specific on symptoms of splitting and rage. And the moment I found out about the study, this was, I think, a short while ago, I immediately got hold of Memantine, because it was fairly easy for me to get my hands on it because I am a general practitioner, so accessing medications is not a big problem for me. And I tried it out. I tried out a regimen of 20 milligrams per day, so I take 2 pills a day, and it helped so much. It helped so much against the rage. It's like a miracle drug. It brings back the brain or my consciousness to normality. Things that usually tick me off and make me split and rage do not tick me off anymore. That is certain sounds that I hear, certain, I got a big thing about hearing someone else eat and using their mouth in a very annoying way while they eat. And I know lots of people get annoyed by it, but the annoyment that I get and the rage that is stimulated out of this is very high. So it's a nice example to monitor how this works. And since I've been on this, it doesn't cause me to rage anymore. Lots of things in my life don't cause me to rage. I can't remember a single split while I was on this medication, so it is highly effective, and it is so effective that I sent a personal thank you to the professor who has done this kind of research, and I told her, I know this is not an ethical way of taking medication, because it wasn't really done by a professional psychiatrist, but I still read the research, and I was convinced, and I used it. And she thanked me. She said, this kind of feedback that we get from single patients is so beneficial. And it was just a good experience. And it does not really cause any side effects. So I don't feel any kind of euphoria or high. The only side effect that I would feel is some dizziness. And sometimes it affects my vision. So sometimes I get blurry vision. But not all the time. So that's regarding Memantine. Now the third pathway, which is believed to be responsible in borderline, is dopamine. So I'll change the color of this. I'll make it a bit more different color. Make it green. Dopamine levels in borderline are affected, and it is believed that it's not. So there is a study in which cerebrospinal fluid samples have been taken from borderline patients, and it has shown that levels of dopamine were high in that fluid. And don't understand me wrong, that is not a good thing, because high levels of dopamine in cerebrospinal fluid do not translate to, hey, that person is happier, that person is more in a good mood than other people. No, it means that the absorption of dopamine is affected. It means that dopamine is not effectively absorbed into receptors that recept and accept dopamine. Something is interfering in the transport of dopamine from the interstitial fluid or space into the cells, and that causes the levels of dopamine to be high in the cerebrospinal fluid. And there are lots of agents. There are three kinds of agents that are used for dopamine. There's either an agent that causes dopamine to have a higher uptake, so it's either uptake is increased or production is increased. Oh yeah, sorry, it's I think it was just two. Yeah, it was just two main mechanisms regarding dopamine. So it's either the uptake that is being increased, or it's three, or the reuptake inhibited. So yeah, there are three lines of drugs used in dopamine. Sorry for the confusion right now, but either the drug causes the uptake of dopamine to be increased, or the drug causes the production of dopamine to be increased, or the reuptake of dopamine is inhibited. That means the dopamine levels rise because it's not being absorbed by the receptors. Now, in borderline, we cannot use this. This is not good in borderline, because we already have high levels of dopamine. So we don't want to inhibit the reuptake. We want to facilitate the reuptake. Production, that's not the problem in borderline either. The uptake is the problem. And the problem is that for uptake of dopamine, there are not many drugs that cause this specific mechanism of action. The high production is caused by, you can use drugs like, for example, amphetamines or certain recreational drugs that increase the uptake, the production. And other lines of recreational drugs also causes the reuptake to be inhibited, but the uptake to be increased itself, there are not many drugs that use this. And not just to mention that there are not many drugs that do this, but also these drugs have not been clinically tested for borderline. So I wonder why. BPD not tested. So there has not been a trial that specifically tests out this class of medication for borderline. Now, what is this supposed to help? This is believed, or what I personally believe, is that this helps against nothingness. So if you're suffering from the constant feelings of emptiness, chronic emptiness, nothingness, and lack of motivation, it is believed that this is caused by the impaired dopamine. So yes, if you're taking Memantine, you can solve the splitting, which is a huge factor in borderline, but you're still going to be suffering from this here. This is still going to be affecting you. You're still going to have the chronic emptiness and the lack of motivation. And this also leads to other things, like if you're not really able to deal with this effectively, if you don't have lots of things in life that really cause you to be happy and excited, this can cause you to be sad or depressed or suicidal. It leads to bad things. This chronic emptiness. It also leads to effects on your work. You're not going to be motivated during your work. You're going to be really bored and wore out of your work, out of your job. And this is good and bad. It's good. It's good because it causes you to seek exciting work. So you're going to be ambitious. You're going to always try to find the kind of work that is really exciting on every single day. It's not a typical 9-to-5 job. You might be doing this kind of business that always has ups and downs and exciting, and somehow relieves the chronic emptiness because it's so high in the dopamine levels that are excreted in your brain during the excitement. And it's bad because achieving this is hard, because the process is boring, and the boringness gets amplified by the fact that you're not absorbing or reuptaking your dopamine efficiently. So the boredom is really high. So that's what I'm working on right now. I'm trying to find the right kind of medication that is not addictive in its properties, that still works on increasing the uptake of dopamine, and that is just basically safe to use. And unfortunately, I don't have the tools to do this kind of research, but it is something that I'm having in mind. Long video, very detailed, lots of medical information on this, but the point here is that you need to gain this. You have to understand the biology, so you understand the insight. You know, okay, I'm having this symptom, that means my brain currently is undergoing one of these 3 pathways. And then you know that you don't want to act on these pathways. So if you're feeling chronic emptiness, don't try to rationalize it. Don't try to think, hey, maybe it's because my life is just bad, maybe I'm not happy in my relationships. But no, don't try to rationalize it, because it has nothing to do with rationale. It has simply to do with this bullshit that is happening in the brain. And sorry for using these terms, but it's just frustrating, right? So don't even try to rationalize it. Just try to find something exciting to chemically alter your brain to reverse this. And don't even try to think of rational decisions to make this different, because it doesn't have anything to do with it. No matter what you're going to do, you're always going to be suffering from it. That's why it doesn't help if you're going to do drastic decisions like splitting with your partner, or stopping your job, or something you may regret doing, some impulsive actions. And yeah, this is responsible for lots of the impulsivity that you see in borderline. It's a good and it's a bad thing. But at least now you know that it's not caused by life itself, it's caused by the chemistry. And that makes you think twice before you want to do something impulsive, because now you know that you just want to do it because you want to reverse this and not because you're actually convinced. So this helps. And finally, you're going to be able to know what kind of medication to use, what, why, and when. So if you use Memantine, you know what it is, you know why to use it, and you know when to use it, right? You know to use it for splitting specifically. So if you take this, you don't expect this to solve everything. You don't take this and say, hey, I'm still feeling chronic emptiness, it's not working. No, you know that it's just working on splitting. It doesn't really work on chronic emptiness. So you know what expectations to have from these medications. So thanks again, guys, for watching. And if you like the kind of explanations that you've seen here, give me a like, write down in the comments whatever you think about it, and give me a subscribe, because your support at this early stage in this channel is of high value for me to keep on going and doing what I'm doing. Thanks, guys.